Good afternoon, and welcome to Covenant's annual meeting with our community. My name is Linda Chow-Turner, and I am the Senior Operating Officer for Rural Acute Operations and Mental Health. I'm very pleased to be your MC for today's event. On behalf of all of Covenant, Covenant Health, Covenant Care, Covenant Living, and Covenant Foundation, welcome. Before we begin, we would like to acknowledge that what we refer to as Alberta is the traditional ancestral territory of a diversity of Indigenous peoples, and home to Treaties 6, 7, and 8. We honor the Blackfoot Confederacy, Kainai, Piikani, and Siksika, the Cree, Dene, Saulteaux, Nakota Sioux, Stoney Nakoda, the Tsuut'ina Nation, and the Métis people of Alberta. This includes the Métis settlements and the 6 regions of the Métis Nation of Alberta within the historical Northwest Métis homeland. We recognize and give thanks to the many First Nations, Métis, and Inuit who have lived in and cared for these lands for generations, all who continue to grace these lands and all future generations. We are grateful to the traditional knowledge keepers and elders who are still with us today and those who have gone before us. We make this acknowledgement as an act of reconciliation and gratitude to those whose territory we reside on and are visiting. To everyone online, not yet, we are so pleased you have joined us virtually today. While we miss being able to see and connect with you in person over a shared meal, we appreciate having an opportunity to include more members of our community from across Alberta and even from other parts of Canada. This event brings us together from different places, organizations, and sectors. And yet, though different, we are bound by a common purpose: to serve our communities. The past few years have reaffirmed for us what we've known for many years. The Covenant is made up of people with an unwavering sense of purpose, a steadfast intention to achieve a long-term goal that's both personally meaningful and makes a difference for our patients, residents, and families. For Covenant, it is our people who help us live our mission to care for the whole person, body, mind, and soul. And it is our people who are helping us to achieve our vision to transform healthcare and create vibrant communities of health and healing. That is why we've chosen to focus on the theme, Our People, Our Purpose, for our event today. Over the next hour, we'll showcase some of our people and hear about their purpose at Covenant. We hope this event will inspire you to think about your purpose in your own life and work. A number of special guests will join us, some via video and others live here in the studio. We'll welcome Covenant CEO Patrick Damali to share highlights from the last year. Wendy Dugas, one of our board members, will bring greetings on behalf of the board. And Lisa Monroe, CEO of Covenant Foundation, will present a special award to a colleague whose philanthropy has improved the quality of life of patients and residents across our organization. We are grateful to have so many Covenant partners join us today. Representatives from the Roman Catholic Archdiocese of Edmonton and several congregations of sisters. Representatives from the Alberta government, Alberta Health Services, and municipal governments. And members of our board of directors and community boards. Thank you so much for being here. We're truly humbled by and thankful for your support. And we're grateful to have so many staff, physicians, and volunteers join us from across Covenant. Thank you for taking time from your busy schedules to attend. We have lots to cover, so let's get started. It's time to introduce our theme presentations. We have invited 3 team members to share their response to the question, what is your purpose at Covenant? Our first speaker is Scott Stewart, a social worker who has been a part of our team for many years, including 18 years at the Edmonton General Continuing Care Centre. Welcome, Scott.
When I first entered into the caring professions, I did so with a deep and abiding sense of calling to help others to the best of my ability in their time of greatest need. That sense of calling has sustained and strengthened me throughout my academic and professional career. I've been privileged to work in the healthcare system for most of my professional life. My journey as a social worker has taken me from community mental health to acute care, to continuing care and beyond. I have met the most amazing people, and I've worked alongside clients of all ages, backgrounds, and circumstances. I have been a part of the most joyous, the most strenuous, and the most upsetting periods in many clients' lives. Even through these most difficult experiences, my sense of calling has helped me to remain grounded and to keep going. And I am grateful that Covenant Health has been an integral part of that journey. My purpose as a healthcare professional has been best realized within Covenant Health. The mission, vision, and values of this organization have continually strengthened my own sense of calling. Covenant Health has given me every opportunity to do what I am meant to do, even when the healthcare system has been shaken to its very foundations. Healthcare has changed profoundly in the 20-odd years that I've been practicing. Technology has advanced, treatments have improved, and clients have achieved amazing outcomes that they were not even possible a few years ago. Yet in the midst of all this change, positive and not so positive, the people of Covenant Health have remained focused on intentionally living the mission through our collective sense of calling and our duty to care. Some say that change is the only constant in healthcare, but I would like to propose that the one constant in healthcare is actually the caring, that people like myself and all my colleagues are doing their very best to help others in their time of greatest need. When I first started this journey, I couldn't have imagined where I would end up, but I am glad that I have spent those years pursuing my purpose with Covenant Health.
Thank you, Scott. It is heartening to hear of your calling to help others in need. I'm pleased now to share this important message from Archbishop Richard Smith.
As we gather virtually once again for the community annual meeting, very pleased to have this opportunity to offer you my greetings. You know, I have to say, and I've said it many, many times, I'm so proud of the Covenant family. Covenant exists to carry on the healing ministry of Jesus. It's that important. And everyone that's involved in our various organizations is so totally dedicated, devoted to this mission, to bring healing to those who are in need, actually to transform the way we deliver care and to create communities of health and well-being. To all of you that are involved in the mission of the Covenant family, I want to say in particular the frontline workers that work so hard and the office staff that support you, my heartfelt thanks and the thanks of everyone in the Archdiocese of Edmonton. And I hope and I pray that our community meeting here today is going to inspire every one of us to look for new, innovative ways to continue on this mission, to make a positive impact in the lives of the people that the Lord has entrusted to our care. God bless you.
Thank you, Your Grace, for your kind prayers. Also sending greetings to our gathering is Alberta Minister of Health, Adriana LaGrange.
Hi, I'm Adriana LaGrange, and I am the Minister of Health for Alberta. I am truly sorry I won't be in person to attend your annual community meeting, but I do want to thank you for the invitation to speak. Covenant is an invaluable healthcare partner in Alberta, and your commitment, right from caring for the newest Albertans in neonatal units through to addressing the urgent needs of Albertans who arrive in our emergency departments, and further to providing reassuring specialized care for Albertans with chronic conditions, as well as offering unwavering support for Albertans in continuing care, all of that is truly commendable. Whether you're on the front lines or in the back offices, in urban or rural areas, your values do shine through your work. Our government is very committed to supporting you in that work. And by now, you would have likely heard of our plans to refocus Alberta's healthcare system. We are doing so in part because we see the extraordinary pressures that healthcare professionals are facing in Alberta. Pressures that get in the way of doing the good work that needs to be done. We cannot and will not do this without your input. This is an opportunity to create a system that works for those who work in it. And we want to know what's working and also what needs to change. If you haven't already, please join us for our healthcare engagement sessions, more of which will be coming in the new year. We are also collecting feedback on our online survey on our Refocusing Healthcare in Alberta webpage, which is on alberta.ca. Together, we can build a system that cares not only for patients, but also for its professionals. On behalf of all Albertans, thank you to all of you for your compassionate care, for your dedication to healing and support throughout some of the very most difficult times that people have to face. Thank you all, and I hope you have a very productive and inspiring meeting.
4, 3, 2. Thank you, Minister LaGrange, for your ongoing support of Covenant and those we serve. In addition, we are pleased to receive greetings from Alberta Minister of Mental Health and Addiction, Dan Williams.
Hi, I'm Dan Williams. I'm your Minister for Mental Health and Addiction here in the province of Alberta. And I'm incredibly proud of all the work that you do at Covenant Health, bringing healthcare to every Albertan. On behalf of every single cabinet minister and everyone in the government that delivers healthcare, I want to thank you today at this annual community meeting and what you do every day of the year, bringing the healing ministry of Christ to every Albertan, no matter who they are or where they come from. The important work you do in delivering healthcare cannot be replaced. Thank you for that. It reminds me so much of the mission I have as the Minister for Mental Health and Addiction, to make sure every single Albertan has an opportunity at recovery, recognizing the dignity of every single one of those Albertans we serve. Thank you again. God bless you, and I hope you have a fulfilled and productive annual community meeting.
Thank you, Minister Williams, for your words of encouragement. We have come to the point in the program where we usually receive greetings from our board chair, Ed Stelmach, who is a champion of our work across Alberta. Unfortunately, Ed is ill today, and Wendy Dugas, another member of our board and a true ambassador for Covenant, has graciously agreed to speak on behalf of the board. We're grateful that she's able to join us live in the studio today. Welcome, Wendy.
Good afternoon. It's a pleasure to bring you greetings today on behalf of my colleagues on the board. Thank you, Minister LaGrange and Minister Williams, for your kind words. On behalf of everyone at Covenant, we are grateful to the Government of Alberta for entrusting us with the work we do, and we are so pleased to include greetings from both of you in our gathering today. Thank you, Archbishop Richard Smith, for your encouragement. We are grateful for your support as we carry forward the legacy of Catholic healthcare in Alberta and across Canada. We also have representatives from different congregations of sisters joining online this afternoon. Thank you for your trust in us to carry forward your legacy of Catholic healthcare, for your unwavering encouragement, and for your constant prayers. We also have members from a number of foundation and community boards across Alberta attending online. I'd like to acknowledge them for the hard work they do in their communities and for the tremendous wisdom and advice they offer our board and senior leaders. As we meet today, our teams are still facing the challenges and stress of caring for patients who are critically ill, not only with COVID-19, but also with influenza and RSV, and they are still working hard to keep our residents safe. The creativity our people have shown in response to these challenges, as well as their dedication to patients, residents, and families, and to each other, continues to be truly inspiring. Our board and senior leaders are so proud of our teams, and we are pleased that our people, our purpose, is the theme of the Covenant Annual Community Meeting this year. This is an opportunity to showcase the diversity of our people and the many ways they assist our patients, residents, and families, whether they work on the front line or in support services. Across Covenant, our people are called to serve with compassion, uphold the sacredness of life in all stages, and care for the whole person. This is our mission, and it has never been so strong and vibrant. Our mission is what has helped us through all the difficulties and stress of the last few years, giving us hope, determination, and the physical and mental strength to continue meeting the needs of Albertans. Our people are also the force behind our vision to transform care and create communities of health and healing. Their commitment to innovation and their passion for the health and well-being of Albertans are helping us bridge gaps in the health system, address unmet needs, and bring those at the margins into the community. The board is grateful to our Covenant teams for continually answering the call to serve Albertans. Our sincere thanks go to each and every Covenant employee, physician, and volunteer for everything you do, whether on the front line or in support services. Our people, our purpose is also an important theme because it honors our roots and the work of our founding sisters. The sisters were visionary women who found new and creative ways to meet people's needs during times of hardship and who valued collaboration and partnerships in supporting those in their care. We are guided by their legacy of innovation, resourcefulness, and compassion. As a board, we work with Covenant leadership to set the direction for the organization in support of its strategic plan. Moving forward, we have defined 3 areas of focus in making a difference for Alberta. Purpose and culture. We will focus on living our mission to meet the needs of those we serve by enhancing our passionate, empowered, inclusive, purpose-inspired team culture. Transformation. We will focus on transforming the health system through innovation, collaboration, growth, and shared learnings to respond to the strength and needs of our communities. Excellence. We will focus on delivering excellent care by maintaining quality, safety, and reliability while being good stewards of our resources. And we will continuously innovate and improve our services. These efforts will be supported by our ability to work collaboratively with others. We are constantly looking for new, more sustainable, and more effective ways to provide high-quality care in partnership with patients, residents, communities, government, and other healthcare providers. Together with our partners, we can create a high-performing health system for all Albertans, now and in the future. Thank you.
Thank you, Wendy. And now it's time for our next theme presenter. I would like to invite Amber Rubin to share her thoughts on the question, what is your purpose at Covenant? Amber is a pharmacist who has worked with us for over 17 years, and she's now also serving as a consultant for Indigenous health equity and reconciliation with our mission, ethics, and spirituality team. Welcome, Amber.
Good afternoon. To understand what motivates me and the work that I do, you have to understand more about me. I come from both colonial and colonized roots. On my dad's and Inuvialuit side, my story begins many generations ago with my ancestors who were strong, resilient, and living in what I would now call harsh conditions. They were able to live in the Arctic and obtain everything they needed from the land, respecting the earth that supplied them with food, clothing, shelter, and a spirituality that sustained them. Their entertainment demonstrated skills they needed for survival, such as physical and mental strength, as well as patience. Their small kinship groups used story to teach, laugh, and pass on knowledge. My father was born into a transitioning world, born on the land, and not in an established hospital, health center, or community. When he was 6 years old, he left home to attend residential schools, never to live at home again. He lost his language, his traditional knowledge and culture, ties to the land, his family, and his community. These lost connections have continued down to the next generation, to my sister and me. It is almost ironic, then, that I have always identified as a Inuvialuit when I was raised in a Western world and easily adopted Western ideas and ways of thinking. I grew up knowing my dad attended residential schools, but at the time knew nothing of the atrocities committed, the reason behind them, or the myriad of forced assimilation tactics used by the Canadian government and religions alike. My colonial side, my mom's side of the family, is from central Alberta, and all 4 sets of her grandparents, originally from Finland, Sweden, Germany, and Ireland settled into Alberta early in the 1900s when there was cheap, rich, abundant farmland. I still have relatives living close to these early established farmlands, still benefiting from these stolen lands. I also benefit when we visit as a family and our children are free to run and play on acres of land. Over the past few years, I began a journey of learning about the true Canadian history with Indigenous peoples. It's not pleasant. It's not easy. I had no idea about all of the harms, the atrocities, and the intentional cultural genocide. It has been a sustained attack from so many angles, and I can see that we continue to work in colonial systems. I have grieved the loss of family, culture, spirituality, and knowledge, not just for myself, but for all Indigenous peoples. This learning has also required a lot of reflection and even resulted in the question of my identity. Can I speak as an Indigenous person when I grew up primarily in a Western world? But then the self-counter argument. I grew up in a small, primarily Indigenous town, Cree, Dene, Métis. None of us grew up in ceremony. None of us grew up with Indigenous ways of knowing or with Indigenous languages. I saw firsthand the harms of colonialism, including the drinking, suicides, dropouts, and violence. But as a child, didn't possess the knowledge to make those connections. Don't get me wrong, I'm not perpetuating all the stereotypes. We had many successful, well-grounded Indigenous leaders in our community as well, but I did see the overrepresentation in inequity. I left my small town after high school knowing that a university education was expected. I obtained a Bachelor of Science in Neuroscience, and then deciding not to pursue doctorate studies at the University of Michigan, I came to the University of Alberta for a pharmacy degree. I've practiced my whole career at Covenant Health at the Misericordia Hospital in medicine, geriatrics, and ICU with amazing teams. I began educating pharmacy students and coworkers within Covenant Health about Indigenous health and those direct links to colonialism. Understanding that I needed to learn more, I started a Master of Science in Pharmacy, working collaboratively with a First Nation. I've tried to do this work with respect and reciprocity by learning more about protocol, honorariums, spirituality, smudging, and the community. I still have so much to learn. The most fulfilling part of the work is being connected to an Indigenous community again. I didn't realize how much I missed it, that sense of community, the joking, easy laughter, and the willingness to share knowledge. Eve Tuck, a brilliant Indigenous scholar, urges Indigenous peoples not to display their pain in deficit-based narratives, but to instead use desire-based or strength-based methods in research. I understand her urgings. She doesn't want to use that pain to shape the reasons we make decisions and wants to have strength as the focus. I do share my pain with you to open your hearts, but I also show you strengths. My family is full of strengths. Both my parents should not have known how to parent based on their own upbringings. My dad lived primarily in institutions and suffered abuses as a child, just based on who he was. And my mom grew up with alcoholics. My life could have turned out very differently, but they both had a strength and a resilience to love, to teach, and to guide. I now, in turn, use strength and resilience to make my Métis and Nunavut children proud of who they are as Indigenous peoples. I try to use strength and resilience for those Indigenous peoples who have no voice, who have been cast to the margins of society, whose stories are similar to mine, but with very different outcomes. My purpose at Covenant Health is to advocate for this organization to follow its mission of caring for the whole person, body, mind, and soul. I call on Covenant Health to follow its values of serving people of all faiths, cultures, and circumstances, with the values of respect, collaboration, and social justice, and to advocate for decolonization and integration of Indigenous ways of knowing to improve Indigenous health equity.
Thank you, Amber, for sharing your inspiring message and for your dedication to bringing hope and healing to the people we serve. This year, we have the privilege of hosting a special award presentation during our annual meeting. I would like to welcome Lisa Monroe, CEO of Covenant Foundation, to introduce the award and the recipient.
Thank you, Linda. This is my first time presenting at the Covenant ACM. I'm so excited to be here to celebrate and recognize the fantastic people who make up Covenant. In my 30 years of work, I've never experienced an organization that lives its values the way that Covenant does. In my role as the president and CEO of Covenant Foundation, I see how each of you lives Covenant's values. I find this truly inspiring, and I'm grateful to be part of this very special organization. Today, I'm here to recognize an extraordinary colleague. This person embodies Covenant's mission in everything that they do. They are a tremendous supporter of our Covenant Foundation, helping us to further our mission of supporting excellence in healthcare where you live at 21 Covenant sites in 9 communities throughout Alberta. Today, I'm pleased to recognize Joanne Malloy, Senior Operating Officer at Misericordia Community Hospital. In November, Covenant Foundation nominated Joanne for a National Philanthropy Day Award to celebrate her philanthropic contributions and dedication to the Covenant mission. Not only is Joanne a longtime donor to our foundation, which partners with Albertans to create vibrant communities of health and healing, but she also acts as an ambassador through her work at the Misericordia Hospital. Most recently, Joanne played a vital role in the redevelopment of the Misericordia's new emergency department and our foundation's fundraising campaign to enhance the new state-of-the-art space. Joanne's passion for patient-centered, high-quality care is demonstrated through her leadership, whether educating other donors about the impact of their gifts, working with our foundation to support fundraising initiatives, or giving back through personal donations. Joanne continues to exemplify and advance Covenant's mission. Her ongoing support enables our foundation to continue driving innovation and sparking advancement in healthcare delivery to benefit the thousands of people in our community who rely on Covenant's care across all stages of life. Thank you, Joanne, for your tremendous dedication. I'm truly inspired by the example you set for all of us at Covenant. And with that, I'm pleased to ask Joanne Malloy to join me on stage to accept this National Philanthropy Day certificate in recognition of her outstanding support for our Covenant Foundation.
Thank you, Lisa, and thank you to the Covenant Foundation, not only for the nomination, but for your ongoing support of Covenant's programs and services.
Thank you, Lisa, and congratulations to you, Joanne, on receiving the Special Philanthropy Award. It is my honor now to invite Covenant CEO Patrick Damali to share some highlights of our work over the last year, as well as some thoughts on what's ahead.
Hello, it's good to be with you today, partners, supporters, leaders, staff, physicians, community members, all of you who inspire us to live our mission. Thank you for your continued support and partnership in making Alberta's integrated health system strong, responsive, and sustainable. A special thank you to Health Minister Adriana LaGrange and Mental Health and Addiction Minister Dan Williams for your kind words. We are so grateful for the Government of Alberta for entrusting us with the work we do. I'd also like to acknowledge the many representatives here from Alberta Health Services and Alberta Health with whom we collaborate every day to improve the care we provide to our patients and residents. As Wendy has noted, COVID-19 has taken its toll on us in the last few years. The reality for our organization, for society, is that COVID-19 will always be with us. As our spiritual heritage teaches us, it's really not for us to determine the circumstances of our lives, but we're called to persevere and move forward with a vision that pursues our mission and our values. And I couldn't be more proud of our people for doing just that. It's appropriate the theme of today's event is Our People, Our Purpose. Covenant is made up of more than 15,000 staff, physicians, and volunteers. They come from many different backgrounds and faiths, but they share a deep respect for the intrinsic dignity of every human being and an unwavering commitment to live our mission and serve all people, body, mind, and soul, with compassion. Our strong purpose-inspired culture at Covenant is among the reasons that we are recognized again in 2023 as one of Alberta's top employers. The recognition speaks to the values we all share and how we bring them to life every day, whether it's providing care at the bedside or setting a strategic direction around the board table. To support our people and transition out of the pandemic, we've made significant investments in talent and organization development in the last year. This work included developing workforce and talent management strategies that will be key to helping us build the workforce we need for the future, rewarding and recognizing our people effectively, and creating an environment where we can all learn and grow. Covenant's mission and vision calls us to create vibrant communities of health and healing. I'd like to share with you a few of the ways that we've been doing this in the past year and how we'll continue to transform and grow in the months and years ahead. One of our major achievements during the year was celebrating the opening of the new Misericordia Emergency Department at the Misericordia Community Hospital. The new DED includes expanded treatment areas, private rooms for people with mental health needs, and simulation training labs for staff and other amenities. We're proud that this $85 million project will enable the hospital to provide a compassionate, patient-centered care environment for the 60,000 emergency visits we'll perform there each year. The completion of the new emergency department is a significant step forward towards having a modern, vibrant Misericordia hospital that will meet the needs of the communities in West Edmonton, of course, but for all of the residents of Northern Alberta for generations to come. During the year, work began on phase 1 of our exciting Covenant Wellness Community, which will be the community health center. The construction is well underway, and we've signed many leases with several groups for medical retail space. We're also in discussion about designated spaces for urgent care, primary care, seniors care, and care for mental health and addictions, as well as laboratory services that will be added to the facility. Once complete in May 2025, the Community Health Center will serve as a one-stop wellness destination for Edmonton's fastest growing and most diverse neighborhoods, and a model for community-based care for the entire province. We continue to work with SE Health in Ontario on the Courage Action for Better Aging initiative. Together, we hosted a virtual summit in late 2022 for 181 changemakers from across Canada. The summit led to the development of a roadmap of 16 actions for reimagining aging in Canada. The next steps will be to develop and disseminate the roadmap and implement an awareness and advocacy strategy to bring the coalition together to begin taking these actions for change. We also continue to develop our Seniors Innovation Platform, a living laboratory designed to address health and wellness needs of our older adults. The first of the innovations we are pursuing is Project SKIP, which will use technology in the homes of older adults, connecting them with health and wellness services and products on demand so that they can age in place and maintain their independence. Looking ahead, we've entered into a new strategic relationship with Tsuut'ina First Nation. We hope the relationship will lead to future collaborations for community and acute healthcare services in their community. We're also encouraged by provincial government's plans to restructure the health system. We see the restructuring as a positive step for areas that have been under considerable pressure for several years. It aligns with our assessment of Alberta's needs and areas where we believe we can add value to the system. We hope that we'll provide opportunities for us to continue to pursue innovative approaches to improving healthcare. We believe we have considerable wisdom to contribute to the new provincial framework, and we're committed to working with government and other partners from different areas of the health system as we navigate the restructuring together. Moving forward, we continue to see a promising future for our province, for those we serve, and for Covenant. Supported by our people, our mission, we could not be stronger. The passion and unwavering sense of purpose they bring to their work are key to our success and our vision of ensuring every Albertan receives the care they need. I want to thank you for attending our ACM today. We are grateful for your ongoing support and advocacy. May God bless.
Thank you, Patrick. We clearly have much to be proud of as an important partner in Alberta's healthcare system and as a leader in transforming health care in our province. We've now come to our third theme presenter. I would like to invite a fairly new member of Covenant, Emile Enongine, site administrator at St. Teresa Place, one of our Covenant care centers in Calgary, to share his purpose at Covenant. Welcome, Emile.
I have been with Covenant Care since June 2021 as a site administrator of St. Teresa Place. Since I joined the team, One of our mottos at St. Teresa Place has slowly become, we take care of our people so that they can take care of our people. We put our staff in the center of everything we do and every decision we make. We make sure that our people know that we care for them and that we will do anything it takes to make them have everything they need in order to care for our residents. At first, our occupancy was at 88% for many reasons. Now we have been able to maintain an occupancy of around 99%, only declining at times due to attrition. The sustained increase in occupancy, although vital for the financial operation of the site, is not enough for true purpose. Rather, it is what has led to this change that gives it meaning. Where in the past, residents whose care was considered to have become heavy or cumbersome were transferred to long-term care homes, in collaboration with our various teams, we have better equipped our staff to be able to care for our residents until the end of their lives, alleviating residents and families from the burden of relocation in difficult times. We have built relationships with transition services where they now reach out to us when they have potential residents who have been labeled as difficult, knowing that at St. Teresa Place, we don't shy away from providing quality, compassionate care to the people who need it the most. My dedication to nursing is one of the most important driving forces in my life and continually gives me purpose. Rather than fulfilling the common tale of nurses eating their young, I've always wanted to work in a setting that nurtures new staff. This is an idea that is necessary now more than ever with the advent of millennials into the workplace and with the exponential growth of technology giving workers more choice and ability to pivot to new careers. I believe our workplaces within Covenant provide the environment in which young nursing students can come to be inspired to pursue this noble profession. Covenant Care provides spaces where they can find a mentorship to take up leadership positions within the organization and within the healthcare system in general. We all know that within healthcare, good nurses and doctors get promoted to leadership positions. While some of them succeed in these leadership roles, most of them struggle, not due to lack of capacity, but due to the lack of purposeful support. With the opportunity as a leader at Covenant, I believe I have the responsibility to pass on those leadership concepts that I have learned through my formal education. I believe it is my responsibility to share information, mentor, and have time to teach in order to build up leadership skills of those around me and to lead all my staff to the understanding that regardless of their role, they are all leaders. Many people find purpose in convenience, salary, and status, and their motivation starts and finishes there. However, for many, including myself, it is to recognize an opportunity to contribute meaningfully to a team, initiative, or goal. As a young organization, Covenant Care, Covenant Living offers fertile ground for us to experiment with new leadership concepts to help us meet up with our peers in the industry and innovate without the fear of failure to create a thriving place of work for our staff and a thriving place to live for our residents.
Thank you, Emil. We are privileged to have you live your purpose with our residents, families, staff, and volunteers at St. Teresa Place. Our time together is drawing to a close. Thank you to our speakers for helping us to explore our theme, and to you for your participation. We hope this presentation has prompted you to think about your purpose and how you live it in your life and work. As you head off to continue your day, please know we are grateful that you took the time to join Covenant at this virtual ACM. I hope you found the time valuable and that you leave here with new ideas and perceptions. If you'd like to revisit today's presentation, it will be available on our YouTube channel, Covenant Health Canada, in the next few days. We will also send you a link to the recording by email. Thank you for your ongoing encouragement, support, and belief in us in Covenant. We look forward to seeing you again next year.